Welcome everybody to the third series of our Leadership and Action webinars. I will turn it over to you, C. Marie Taylor, to start.
All right, well, good morning on this rainy Thursday. We're so glad to have you here with us. We've got some fantastic panelists for our Leadership and Action series. This is number 3, third time's a charm. So we're really excited about this group. So I'm going to introduce them. They're going to say a little bit about their current state, and then I'm going to launch right to the questions so that then you have time for your Q&A. So as you're listening to our warm-up questions, start thinking about your questions and send them to the Q&A, and we will call on you. So first, I'm going to introduce Robert Dorfman. He is the director for Montgomery County Alcohol and Beverage Services. Welcome, Robert.
Thank you. Pleasure to be here. I think first thing I'd like to say is that given the circumstances that we all find ourselves in, I am not only honored but proud to be a part of a team that has Chief Jones and Chief Goldstein a part of. I know what they have to deal with every day and their employees have to deal with every day. And I'm proud to say that I'm a part of what efforts that they are making to keep our county safe and healthy during these very difficult times. So having said that, we were back about a month ago, a little over a month ago, we were deemed by the governor as being an essential business. And prior to that, and still today, we continue to support 1,100 of county businesses and 25 of our own operated retail stores. And, of course, we had, as soon as this had started, we put a plan in place. It was basically a 3-phase plan for both our warehouse and our retail stores, to deal with how to service our customers and at the same time keeping our employees safe and our customers safe as well. But for a few tweaks, we've actually been operating under kind of a normal operating plan. Our warehouse is open and servicing all of our customers, and our retail stores, we have 24 of the 25 stores open. The only store that's closed is a store that was inside of a mall, which the governor has closed and not made available the inside of any of the shopping malls. Our challenges remain pretty much the same. Staffing. We've had numbers of people who have chosen to stay home to take care of either children that they have or grandparents that are home, and also PPE materials to ensure that our employees remain safe. But having said all that, we continue to operate all of our stores and we continue to operate our warehouse. We've led the county, or the state actually, on some of the services that we're providing to our customers. We were the very first to initiate the ability for our customers on carry-out and delivery to also sell beer, wine, and spirits. And we're pretty proud of that. And we're also very proud of our 460 employees, almost all of which are public-facing employees. And so today they continue to do their job, realizing that they're in front of the public and the customers, and we work very hard on keeping them safe.
Thank you so much. All right, Scott Goldstein, Fire Chief, class of 2018. You are up next.
Well, welcome. Thank you, Marie, and everybody here. As MCFRS, the fire department for Montgomery County, we are absolutely working with each of you and the community and the residents as we're going through this pandemic. It is something that we engaged and changed our operational posture 2 months ago. We started at the beginning of March, changing our posture. Planning started in January, but the adjustments started at the beginning of March. So it's really unique to realize that was 8 weeks ago, and we've been at this for 60 days now. We are very proud of the men and women, about 2,700 folks of MCFRS that are answering the calls. Our calls have been down. The demand for fire rescue and public safety, and Marcus will talk about it as well, it's less. And that is a good reprieve from the demands. Some things are up, but the general situation is less. Key component that I want everybody to understand is absolutely, if you are having a medical emergency, COVID or non-COVID, call 911. Don't defer treatment. Don't defer the focus and the attention. Absolutely, as a whole community of health partners, we've said to call your private healthcare provider first. But if you're having signs and symptoms, having a medical emergency, do not be afraid of going to the hospitals for fear of this disease. The hospitals are very deliberate in how they're working to keep those in the hospital healthy, and very deliberate to ensure that the people get appropriate care. And 50% reduction in hospital visits is what the hospitals are seeing during this pandemic in the ERs, which is what the area we focus on. So it is absolutely important for people to touch base with their primary healthcare providers, ensure that they're not deferring a medical treatment or a medical situation. And what we are seeing is sicker patients. While our call volume is down, we are seeing sicker folks that we are engaging with. And then that's a sign of this deferred treatment. The opportunities are there as we talk about the social distancing, face coverings, hand washing, all of the public health components to keeping healthy throughout this. It has and is making a difference, but absolutely everybody in the community needs to be aware and be reassured that the fire service is here. We have additional capacity because of the pandemic, and we are ready to support all of those million+ folks in need. So thank you for having us.
Okay, thank you, Scott. All right, next to our next chief, Marcus Jones, Chief of Police. Welcome. Thank you so much for taking time to be with us this morning. And tell us about the current state of affairs with you all.
So good morning. So again, thank you all for also allowing me to share with all of you some important issues that are going on in Montgomery County as it relates to the police department. And I will tell you, it's been a very unique time, I'm sure, for as it is for everyone. But really now in policing, this is really something that we've not seen and had to adjust to accordingly with different aspects that are occurring in things that are happening in our community. I think one of the things that when we look back since this has really began and then when the state became really involved outside of what we were already doing in county government, was that now we had to adjust to the governor as he began to present orders that really was impacting the community from a public health standpoint, but that involved really some enforcement expectations on his part for us as law enforcement to address some of these issues that were occurring throughout our community and the rest of the state. And so we had to really come up with a plan, and part of that was really to collaborate with our other law enforcement partners throughout the state, as an example, to really come up with ideas that we think that would be best served in the public safety community, dealing with our community members in a sense that would not create a negative feeling towards policing and enforcing of the governor's order. So that was really important for us to really talk to the community and express messaging about really about getting people to voluntarily comply with the governor's order for the betterment of everyone. And that was important because then we had to start really documenting how we were responding to calls for service as related to the governor's orders, as an example. So again, these were things that we have never really, on a large scale and for a longer period of time, have had to deal with. But I will tell you that calls, as Chief Goldstein had noted, that our calls for service are clearly down across the county. But what we are still seeing is crime is still occurring. We are still seeing issues that center around crimes such as domestic violence that has given me some concern, and we've really focused on how to address that with other county partners and in the criminal justice system. But we've also had other crimes that are occurring, as we knew that as people were, as they were quarantined, you might say, in their own homes and having to stay there for quite some time, that there were going to be some issues with that. So, but from the larger scale, we will say that crime is down, which is good. But we are still out on the front lines, making sure that our community is safe. We're trying to be visible, protecting the community from not only, just doing our public safety mission, but making sure that businesses are protected and that people are also abiding by the governor's order.
Thank you. All right. And last but not least, we have Lily Chi, Core 2005 delegate for District 15, Maryland House of Delegates. Welcome, Lily.
Good morning. Thank you so much, Marie, for organizing this and for your leadership. This is a great forum. And I first want to give a shout out to all my Montgomery County colleagues for the stellar job and the leadership you have provided. This is often the first line of contact for a lot of our local residents. And I've been really impressed with how the county has responded to this crisis. I also want to say, as a relatively new state legislator, this is my first term, only second year. And by the way, nobody would have foreseen how, unusual and surreal this session has turned out to be. But I would say because of this pandemic, whereas in the past, a lot of people did not even know who their state representatives are. They may know their Congress people, they may know their county council members, right? But they barely would know who to vote for even, and in the state legislature. But now, this pandemic has pushed the state government's importance to the forefront. We not only are the bridge between the federal and the local efforts, but many of the executive orders and the policies come directly from the state. And so I have been really impressed with how the state, local, federal efforts have been coordinating, and I joined as many Zoom calls as I can to keep the communication flowing. I think one critical role government can play at the time of crisis is to communicate as much as possible of any updates, even though we sometimes overlap with each other, but that's okay. People want to hear from their representatives and have the line of communication open. Our office has been pushing out, for example, and I know many of my colleagues do the same, weekly updates because things change so fast, and we push out federal, state, and local updates, and also have Zoom town hall meetings with our constituents to get feedback and directly talk to them, and also just do a great job in constituent responses and constituent services, especially now more than ever. People are counting on us. And our office has got a flood of emails complaining about how, initially they couldn't get through on the unemployment insurance or any kind of applications, and money got depleted quickly and all that. So we had to just navigate the different systems to respond as quickly as we can. And give people hope that waiting in line means there's still a chance to get through. So it has been challenging, but I am just very proud to be able to play this role. And since the Sunny Day, which is the end of the session, that ended earlier than usual, I have been drawn into the local, especially Chinese American communities' tremendous efforts in sourcing and donating PPE to over a dozen local hospitals, most of them in Maryland, and to first responders. So I connected them with MEMA, the Maryland Emergency Management Agency, and also to the first responders. I connected with the fire chief and the police department. And I have been just so impressed with especially the Chinese American community in how they are not only using their professional knowledge, because there are many people in the medical fields and also in biomedical fields. They use their knowledge to pull resources, raise funds, and get shipments quickly from China directly to donate to Montgomery County. And this is the way to respond not only to the virus itself, but also to the stigma that came with being Chinese American, for something that happened in another country that we have no control over, and to go beyond the global politics between the two governments to look at how we can help people locally as local Marylanders and local Americans. So I couldn't be prouder and was very glad to be able to be part of this growing efforts. And finally, I just want to say, I appreciate the Chief Jones on the phone. I know he led a conference call with a lot of Asian Americans about hate crimes. I had a follow-up call because many people couldn't get on because it was so popular. I had a follow-up call with the commander of District 5 Police Station, Captain Mark Blazinski, and we had a good conference call with the community again to answer their questions and share a lot of resources and tips and information. So I am just very glad that we are able to do what we do at this time.
Thank you. So many of you talked about ways that you've had to pivot your work and different strategies that you've had to implement. I'd be curious, and actually I'm going to start with Scott because something you said struck me, and I'll go back to a couple of you about ways that you've had to change your crisis plans, ways you had to manage your basic operations. And then Robert, I'm going to go to you because you talked a little bit about this as well. Because Scott, you said that you had started working on, your team started working on this in January. And so talk to us a little bit about how your plans have shifted. What's that looking like?
So seeing this in Wuhan and overseas in January, we started discussing this, looking at our infection control plan and how it was structured to help us. We've had experience with SARS, with Ebola, with H1N1. Some of those are over a decade ago. And we had contingency plans related to changing of staffing and maintaining a level of service with a 20 to 30% reduction in available staff. So that's what we started reworking on and engaging with. The main focus there was, and Lily hit it on par, was communicate, and over communicate. As we worked to provide information to our folks in such a rapid and timely fashion that how they could wear the appropriate PPE, because it was shocking when we sat back, some of us who've been around for more than a minute, but we sat back and realized even Ebola, which was, 6-7 years ago, how many folks weren't with our agencies at that time, and how we did a much heightened state of protective equipment for those potential patients. We really had to hone in on a traditional routine heightened PPE level, and the CDC kept changing that. We kept reacting to the CDC changes, and that has been one that some of the equipment that we procured 10 years ago is absolutely frontline this go around, and has what provided us the depth of support we already had in hand to get through roughly the first month and a half of, because we made orders in January and we haven't even seen those orders be filled yet.
So you're still waiting on them?
On some things, absolutely.
Could I chime in here? I'm sorry,
Yeah.
go ahead.
Go ahead, Lily.
Yeah, just, what the fire chief just said triggered some thoughts on me. And I know in the community's efforts to try to source PPE, from another country, especially China, because they had a lot of shipments. And then when the rest of the world all were scrambling to try to get stuff, there was a lot of confusion and bureaucracy on both sides as to what the United States is allowed to receive. And the confusion with CDC guidelines, FDA guidelines, caused us to lose time, precious time on the hospital's part to be able to receive the needed shields and equipment. So it is a real issue that we have to deal with at a local level.
Thank you. So Robert, I want to pivot over to you for a second, because you said that you had 3 plans for your staffing of over 450. And so what level are you on right now? And do you see moving to a different level at some point?
I think we're at level 2 in terms of our being, having an operational plan. But I think what I find, what everybody might find interesting in terms of even the people that are watching this, is that you've got the chief of police, you've got the fire chief, you've got a state delegate, and then you have the person who runs alcohol beverage services, and kind of wonder, well, okay, I understand the first 3. Where does this 4th one kind of fit in?
Right.
And I guess as a layperson, I would sort of step back and ask the same question. But let me give you one sense of things to answer your question. Having been in my previous life a restaurant owner and operator, amongst other things, and looking and listening to what the national news talks about in terms of those people who are suffering and suffering terribly. Many of them are restaurant operators, small mom and pop restaurant operators, small mom and pop retail stores. And then we have to figure out, okay, well, what role do we play in it? Well, we play a substantial role. And then talking to a number of our, what we call licensees, our customers, it's evident that the fact that we're able to supply them for just their carry out and delivery business keeps them afloat in many instances. That we're providing a very valuable service. And talking to one of them just more recently, where they told me that they're doing 30% of the business they used to do just through their carry out. And the fact that they're able to deliver alcohol, whether beer, wine, or spirits, adds, because it's a high margin item, has kept them financially afloat. And so we provide, I think, a very valuable service. At the same time, as we mentioned, as I talked to you earlier about, there's a safety and health issue that comes into play as well. You talked about domestic violence, and we're playing a role with that. But we also have to make sure that the public remains safe and healthy when it comes to alcoholic beverages for those people who are remaining in their houses for long periods of time. So we made a lot of adjustments, but our job, given the governor's directive, is to make sure that we can properly support 1,100 licensees and 25 of our retail stores to keep other people in business.
Thank you. That's a good point. And I think that's a good tie. And you probably answered questions for some of the folks, but we really felt like it was important to have you because you are part of this ecosystem. And to that point, Chief Jones, you talked about some crime is down lower, some is up higher. And so I wonder if that dovetails into what Robert was talking about, particularly with domestic violence, and what types of crimes have you seen rise right now?
Yeah, I mean, and some of those has resulted from, for example, like with assaults, and sometimes what we deem to be the more egregious assaults is the aggravated assaults, right? And so with that being said, sometimes with sort of, when people like Robert has noted, when people are at home and, really kind of, not, they're drinking probably more than, and this is in some cases, and then sometimes people are getting into arguments as a result. Sometimes and alcohol can be a cause. Then that causes our response to those to those residences and to address those particular situations. I mean, we really haven't seen, for example, issues with a major issue with drunk driving, which is good. Because there are less vehicles on the road, but we are paying attention. And yes, there are still some arrests that are occurring as a result of drunk driving. But one of the things I think that was important for us to sort of adapt to was, one of the main concerns I had as we were paying attention across the country, particularly other law enforcement agencies, for example, NYPD, where they were starting to exhibit many cases of COVID that were impacting their officers and other employees. And so we felt as if that we really needed to be prepared in a way that what would happen if we had many of our officers go down with the actual the COVID virus and were unavailable. So of course our patrol officers from our 6 district stations are our frontline people who are responding to calls for service every day, 24 hours a day. And so they are, are really the essential folks that we really need to be out there. And my concern was the effect that if they go down, what are we going to do in the meantime? So we really had to come up with a staffing plan to really take, to have backup officers available. And so we looked at our other support officers who work in other divisions our detectives, and we really came up with a plan to have them really go home and telework in most aspects, which is unprecedented in law enforcement. We've never done that before,
Absolutely.
right? And so, but we felt that we needed to have a pool of people just in case we lost, for example, one whole shift because of an exposure. All right. And we've been fortunate because we haven't had that, but we had to put that plan into place and change schedules. And part of all of what we do when we work with that is that we have to have an agreement with the union and the unions on our both our sworn and our professional staff in order to change their schedules and to have them readily available and really change the entire work environment. So that was a major shift for us. And I'm proud of my people because everybody really came together when at crunch time, because we had to really do it in a short period of time. And everybody came together understanding the need and the safety for everyone.
Thank you. And so that dovetails into one of our other questions. And actually, I'm going to pivot to you first, because you talked a little bit about this with having to close down the session early, right? And so we all had plans. And so now they all look differently, right? So Chief Jones talked about some of the plans, and even Robert alluded to this about some of the plans we had initially. Now they've had to shift. So what does that look like for you all since we had to shut down sooner?
Is that to me?
Yes, Lily.
Oh, okay. Well, this is a very unusual year because of the pandemic, whereas normally during the interim, we would still do a lot of constituent services, but there could be a diverse range of issues that people are concerned about. But now, I would say like 90% of emails and whatever contacts we get are related directly to the pandemic, whether it's availability of testing, which is one of the top issues of concern, and especially the safety of staff and the residents at nursing homes and assisted living facilities, right? And access to or the status of people's application to emergency relief funds. And so a range of issues are related to the pandemic, but still, it's a matter of constituent services during the interim and the preparation for the next legislative year. So in that sense, the nature of the job is the same. It's just the subject matters have dramatically changed and the intensity has changed, because now, as I said, we are pushing out, like my office has been pushing out weekly emails, and we all have signed up for Zoom accounts to hold these Zoom meetings. So the dynamic has intensified.
Thank you. So one of the things we've been talking, we're going to jump in, Robert.
Yeah, would you mind? I just want to add something to it, because I think we all have to recognize, and I think we do, the amounts of pressure that people feel today, both personally and professionally. I think part of our jobs has to be in trying to support them in a way that minimizes the kind of distress and depression that people will tend to feel. And so I know what we've looked at is, what do we need to do in our business to make it as easy for those who remain open in business? How do we make it as easy for them to continue to survive and to put food on the table and to put gas in their cars? And so the things that we've done are kind of subtle. We've gone from 4-day-a-week delivery in our warehouse, or from 5-day-a-week delivery in our warehouse to 4-day-a-week delivery in our warehouse. We have a drop and go system where we now drop product at the dock, and pretty much an honor system for our licensees to tell us whether or not they've gotten everything they were supposed to receive. And if not, they just need to call to get credit. But it saves our drivers and their employees from having to be exposed to one another. The same in our stores. We've lined all of our stores so that people are being socially distanced by six feet each, depending on the size of the store. We only let a certain number of people in at any given time. We put up plexiglass shields in each of our stores to prevent customers and cashiers from being exposed to one another. So I think we've taken all of these subtle steps to minimize what we all recognize as being a lot of severe depression on the parts of residents and businesses in this county, try to make it as easy as possible for them to continue to operate.
Thank you. Yeah, so, and to that end, Scott, are there other pieces of your work that you're now doing differently?
So there is, and through the 911 center, we have implemented additional call screening and information or intelligence questions. Every person who calls, no matter if it's for a police or fire incident, is being asked, is there a person there with a fever or a cough? And as the circumstances develop, the question also was added, is there anybody COVID positive present? Because while it may not be an EMS event or something we're anticipating a medical patient, it may be a law enforcement, somebody burnt the toast in the toaster, the need to address the appropriate protection. So that has changed collaboratively between the police and fire department at just the 911 level. The other components are, we had a partnership with, and still do have a great partnership with, Health and Human Services with our mobile integrated healthcare activities, where we work to have people engage with HHS resources and county support resources in lieu of using 911 as their safety net. We implemented and expanded that with a change in the protocol for what was best described as a stay-at-home approach, where we could come medically assess the patient, and if the patient was willing and met the criteria, support them and have them stay in place at home, and then touch base with them 24 hours and 48 hours later. So those are service changes, service expansions that we've put in place. Additionally, as we go about the pandemic, we're engaging with about 60 patients a day. On a daily basis, we transport just shy of 200 people to the hospitals. But we're transporting about 30% of our daily patients who are having symptoms related to this virus. And that's imparting a higher level of protection equipment, a higher demand and work process, and a length of cleaning and sanitizing for both the crew as well as the resource, the unit. So we've added additional folks at the emergency rooms throughout the 6 hospitals to help be focused just on sanitizing the EMS unit and enabling that unit to return to service faster, so that we could get back out into the community. So there's a lot of those different service adjustments that we have implemented. And a very positive benefit to the pandemic is our leave utilization is down significantly. There's nowhere to go. We all know that. So you can't take leave. Your opportunities to take a vacation, be it spring break, which was 2 weeks ago, or just a trip that you may have had planned unrelated to the school calendar, you can't do that. So there's a much higher workforce availability coming to work or coming to their volunteer periods, which, as Bob outlined, we have folks who are at risk for this disease, and who are, because of the county doctors as well as their private physicians, suggesting and implementing the fact that they avoid coming to work because of their personal or their familial risk factors. That has impacts to all county agencies, but the front-facing units like the 3 of us, support, that's just a little chink in the workforce availability. Luckily, it's been a low number, and it's one that one that we've been able to adjust to. It was one that worried us that it was possibly going to become a major issue and we would have challenges with, but it didn't turn out to be that way.
Right. Thank you. And I think one thing I really want to point out that you all are talking about, and Robert said it exactly, is the amount of pressure that you are all facing, right? Whether it's constituents calling and trying to get through and getting messages back out, and then being in the actual front lines, right? The amount of pressure that you're all dealing with is something I think that we definitely want to acknowledge and kind of lift up and support and think about as we're talking through this webinar, is that line of pressure. And I think the other common thread is the over communication, and to see that you all are so coordinated and friendly and cordial and invested in each other's well-being is really important, and shows, I think, why we are doing well, I think, if in a county, given the number of people that we have. And I think Scott alluded to that before that we started. So I know we've got some.
Could I chime in again on this, since when we are still on this subject? I would say, usually when, as publicly elected officials, especially, and really for all of you too, because you're all public figures, we often go to community events, right, before the pandemic. And we would run into people, a lot of things could be communicated on the spot. There were a lot of casual encounters that were super efficient, in connecting with the community. And now this is a big challenge for elected officials, especially because we don't get immediate feedbacks other than people taking the time to write to us or call us, So we have to take the initiative and be very disciplined to take the initiative to over communicate. And that takes efforts. So this is a big game changer for us. And also working from home feels like you just don't stop working. You can't really get away in a way, So talking about the availability of workforce, that's part of the dynamic too. Yeah.
Yeah, you're right. I can't remember who said on the panel about working, just going through 12 hours a day. Was that you, Robert, I think? Or was that Chief Jones?
Yeah, I think Robert said it and I seconded it. Yes.
Yeah.
Yeah.
There's a question about child abuse. Chief Jones, I don't know if you touched on that. There's a question.
I did not.
Okay.
And I know we talked a lot about domestic violence. Child abuse reporting is actually down. And part of why we think that is the case, generally, our child abuse reporting comes from outside sources such as schools, school counselors, as an example, or social workers. And because people are not leaving their homes, of course, with our children being at home as well, then that reporting is not necessarily as out there as we have been accustomed to. So that's a challenge for us because we have to create these avenues, right? Just like in domestic violence, where people who are sort of are in their homes and don't have the ability to get out and be able to message or call outside of to get away from, for example, their abuser. So with that being the case, that gives us some pause that we have to find ways to be able to better communicate with, again, with adults is a lot easier than doing it with, of course, children. But we try to message in a way to get people to, for example, neighbors who might come in contact with individuals, or other avenues of messaging that we get that we can come in and actually do investigations. So that is that again, the numbers are down. We're not seeing a large scale of that, but again, it's something that's still on our mind. What I would say also as it relates to messaging is that we have to really adhere to our community fears about a lot of things, right? Because again, they're going through something that they've never experienced, as we all have. But again, when it comes to our role as in law enforcement, how do we address some of these things? For example, in the immigrant community, particularly as related to undocumented individuals, there were concerns that we were going to, in response to the governor's order, now stop people randomly to check, whether or not they were doing what the governor ordered, as well as to check immigration status. So we had to make sure we had to continuously put out the messaging that that's not our role, that's not what we do, it's against our policy, the policy has not changed and won't change. And so we wanted to make sure that that messaging was out there, as well as Lily noted earlier, in regards to the Chinese American community, where there was concerns about hate bias, right, and hate crimes that were occurring or possibly occurring in their community. We had to really address that because that was vitally important in this environment, because we've seen that across the United States, that there have been incidents that have been concerning to many in the community, and rightfully so. And so we had to basically address how we would handle that. So those are things that really are vitally important for us to continue to make sure that we are putting out messaging, not only outside to the community, but I have to message to my officers weekly. I have come up with new ways, and my staff has been great in innovative ways to get me to message to them, because it's, again, I'm not seeing the majority of them because many of them are front facing, and when trying to stay away from each other, you might say, we're in fact having what we call virtual roll calls. We used to come together as shifts at the beginning of your shift and talk about all of the things that impact in law enforcement that they need to know as they are given their assignments for the day. But
Right.
we have actually had to have a change with that. But I've had to really be able to communicate to all of the employees who are teleworking and who've been sent home in order to be able to get out what's going on with the county, what's going on with the state, and the things that are impacting us and how it's impacting them in doing their jobs every day. And that's been vitally important. And
Yeah, and
getting
I
good
think with the
feedback from that.
innovation, I think with the innovation, it's great the way that you all have talked about ways that you're figuring out to do your work. And I think it's also difficult though, because you're not in those quick spaces where you can say, hey, yes, you're supposed to be doing this. Hey, you're supposed to be doing this. And there's public fear that you mentioned is a big issue, right? Particularly in all your places, right? Thinking about going into a liquor store with a mask on, I'm like, what? Everything in my being says, oh no, you're a Black lady, don't go to the liquor store with a mask on, right?
Yeah,
But that is what we're supposed to be doing, right? And so we're running out of time, and we've got a bunch of questions in the queue. So I'm gonna let Carmen Ford, I know people wanted to comment, but I wanna get to some of these questions. And hopefully you can tie your answers in. Carmen Ford, our Director of Membership Marketing, is gonna read us our first question. Carmen, go right ahead.
Sure, thanks. So how are you coordinating with neighboring jurisdictions for those households who maybe work outside of the county, and vice versa, those households who maybe live outside the county but work in Montgomery County? How are you coordinating with the neighboring jurisdictions?
All right, Scott, you want to jump in?
So we're lucky that the DMV is very coordinated normally through the Council of Governments, and the activities between Mayor Bowser and Governor Northam and Governor Hogan have been pretty succinct and aligned. But when we talk outside of jurisdictions, we've had issues pertaining to some of the stay-at-home orders and the abilities for folks who live outside of Maryland itself, and how that impacts our workforce, because the opportunities for the return to Maryland and how that must imply a 14-day quarantine, as we had the tri-state issue develop up in New York, New Jersey. Mm-hmm. And that has been one that has impacted our work unit. And we also had folks who, for a multitude of reasons, left the general DC area and may have gone to the West Coast or to Florida, and then had to come back into the DC region and then integrate back into work environments with the limitations on travel restrictions. So it is one. I was on a conference call this morning with the COG fire chiefs, the Council of Government Fire Chiefs. So we're doing those weekly. We also have a weekly communications with the Maryland fire chiefs. So it's definitely a part of what is normal for us here in this region, to talk with and interact and support our partners around the region in fire rescue and public safety. So it is definitely there, and there's no doubt that the roadmap to recovery, or the return to state after COVID, will be integral between the two states in the District of Columbia, because we cannot obviously have one really proceed in advance of the others, because that'll become very confusing and cause a lot of problems.
Thank you. Anybody else want to jump in before we go to the next question? Okay. All right, Carmen, what's our next question?
Sure, I'm going to combine kind of two questions that we have. How has your leadership been tested during this crisis, and what has been the hardest challenge on your department to date?
So that's a great question. So I actually want to go round robin and hear that, since we are Leadership Montgomery. So we'd love to hear a quick answer from each of you. So Robert, we'll start with you.
Okay. Well, again, I think we view ourselves as a required support business to a number of other businesses and residents, but businesses in Montgomery County, 1,100 of them. And we become a important and integral part of their day-to-day success by providing them the products and the services that they need in order to remain successful. To the extent we don't do that well, we cause them to have financial issues, both professionally and personally. And like I mentioned earlier, I think a big part of our job is to not impose any of our pressures on the people whom we service, and that we should try to do things as normally as we possibly can, and as subtly as we possibly can in terms of any changes, to ensure that the people whom we're servicing are serviced as well as possible and can basically live to see another day. And I think that that's our motto, it's our challenge, and we've got to do it really well.
Thank you. Lily, what's your leadership lesson for us?
Well, there are many. Let me just touch on a couple of them. I think one important quality of leadership is just to be able to pivot as quickly as you can, depending on the circumstance. And oftentimes leadership is situational, right? Whatever is called for. So in that case, when I came back home from the session, I immediately realized that there was a lot of work to be done, and I jumped in on several fronts. One was just to start coordinating the local Chinese American community's desire to donate to many hospitals and first responders. Since I have these contacts, it was easy for me to make these connections to be efficient and not lose precious time, you know. So I reached out to hospital executives and all that. The other is just, you know, to confront this bias about Chinese virus. Back then, you know, the president was still very enthusiastically calling it Chinese virus. And some of the national leaders also joined the chorus. And that actually really scared a lot of people. And there was a spike of 300% gun buying in some Rockville-based gun shops. And that was well documented. So, you know, as community leaders, we stepped up and not only work with police department and others, but also to put out a lot of messages to tell people, you know, what they can do to defend themselves without resorting to guns as the first tool, right? And so, you know, whatever it takes, we just pivot and try to be as responsive as possible. And the other thing is, because I serve on the House Economic Matters Committee, and I have always been very focused on business development and economic development issues. This is a great opportunity to bring along a lot of other people to understand that not all businesses are the same. You know, as Mr. Dorfman mentioned earlier, a lot of businesses have been struggling even before the pandemic. It's a competitive environment, and hopefully through this pandemic, we all can learn a big lesson that when businesses fail, communities fail, that we need to adopt a fresh attitude about how to help our small businesses that make up an important fabric of our community. So I've been, you know, joining Zoom town halls hosted by like the Clarksburg Chambers. It's this coming Tuesday, but I joined the Montgomery County Chamber of Commerce Zoom town hall a couple of weeks ago about legislative highlights and the things that we are doing to help businesses. So, you know, these are different priorities because of this unusual time, but whatever we can do is to make ourselves useful.
Thank you. And that point you made about when businesses fail, communities fail, rings true. And I really appreciate how all of you have talked about how the support to businesses are key in all of the work that you do. All right, so we have we have 3 questions in the queue. Okay, Chiefs, give us quick your one leadership lesson. I'm gonna try to get to these last 3 questions before we run out of time.
So I will just chime in and just say change management has been been my toughest challenge. And when I say that, we talk about every day is a new day. Well, I will tell you, every day brings about a new challenge. And we've seen this from the beginning up to where we are today. And so that's really been where I've had to be able to adjust myself on the fly and really work with my staff as these things come at us. And change the way we do business, and to get that message out and to get the buy-in from my officers and my professional staff so that they understand that they've got to adjust and we have to conduct business in a different way. So that's been my toughest challenge.
Thank you. And Chief Goldstein?
And the words are very similar. It's rapid decision making. We are having to make decisions very rapidly. and with the best information that we have at hand, and that is one of the character traits of public safety naturally. But the reality is we will make mistakes, and we will have to learn the mistake we made and adjust and restructure what that direction or operational point was. And Lily talked about pivoting, so it's very much ties with that. But then it's about communicating as we make that change, outlining that we learned something differently, and this is why we're making a change. And it is that rapid decision making, because we can't take time to gather for a meeting, to gather a group together, to analyze it. We got to get as much information we can in a very short order, make a decision, implement it, learn and adjust from it, and if need be, correct the error, acknowledge that it was a mistake or an error, and move on to the next topic, because there's fires to put out, or there's crimes to investigate.
Can I add one other thing?
Yeah, sure, Robert.
One other thing real quickly. I think, we've all kind of sat back and you listen to all of us talk, and all of our people who work for us and our customers, and what you hear mostly is, boy, I can't wait to get back to some sense of normalcy. And there's going to be that new normal, but this whole sense of getting back to a sense of normalcy. And I think one of the things that I think we all are trying to do, and I can speak for ABS, is that even while these things are going on, we're doing things that we would otherwise normally be doing, but just in a different way, so that people don't feel like that the day is not the same day as it was before. For example, we're doing our training, but all virtual. We're doing our Keeping It Safe program, where we have high schools and middle schools who have submitted videos to be awarded for showing how to keep students safe and underage drinking under control. And Chief Jones is a big part of that, along with us.
Right.
So we're doing a lot of things that we try to do as part of being normal, to try to keep a sense of normalcy, in addition to having to pivot and do all the changes that we have to make in our lives and in our business life. But I think what's really important here is that as much as we can to keep a sense of normalcy is going to be really important for people's mental health, if anything else.
Yeah, I would agree. And I think the other thing I hope is illuminated, particularly with today, is the importance of folks who are working on the front lines. And I feel like oftentimes you all are just kind of in the background, just making it happen, right? That nice guy that handed me my rum chata, that nice officer that helped me figure out the directions, right? Or gave me my speeding ticket, not that I was speeding, Chief Jones. But
We won't ask.
what I hope and pray is that we have a different level of respect for our frontline workers, right? Whether they're in the grocery store, on the fire truck, in the police car, we have to have a new level of respect for these folks that I don't think we had. We have an opportunity for a new level of respect. I'll stop there. All right, Carmen, let's see if we can get these last couple of questions in really quickly.
Sure. Where can the public find a list of COVID testing sites that are available to them? Is there a website, or where can they go to find that information?
Okay, I see
I'll
that.
be happy to take that.
Yes, go ahead.
Well, I know in Montgomery County, we just added a couple of new testing sites. With the Wheaton Community Center is now repurposed for that, as well as the Up-County Regional Services Center in Germantown. And then also there is a VEIP station, which is a vehicle emission inspection station, now has been repurposed in White Oak for that. But for an individual to have access to the test at the current point, unfortunately, you still have to have some symptom for your doctor to request an online order. And once that order is put in by a physician, then you can get an appointment. With that appointment, then you can show up at any of these testing sites. But the governor is expanding testing to all of the nursing homes. So the people in residents in nursing homes no longer need to go through that waiting process. They can just, all be tested.
Thank you. Scott, did you want to jump in?
Well, I was providing Carmen a link that is the county's coronavirus site that she could use to push forward into the group chat. And Lily hit the point on par. Dr. Gales and Public Health has supported and worked on many different areas across the county, but it is by doctor's prescription. And that's the most important fact. And as testing is, it's becoming more and more available. And as it's there, you know, now you can get that and get a result back within 24 to 72 hours. So it is absolutely first contact your private health provider. If there's a problem on that level, touch base with the folks at 311. They can direct you into a path of getting some reference there. But through the White Oak drive-up testing, through the Wheaton Library and Rec Center, Up County Community Center, there's places across the county on different days in the week that Montgomery County is working to provide that for those with a prescription in hand.
Thank you. And it's important to note, though, there's a lot of county residents who do not have a primary care doctor. So they're going to have to go to public health places to actually get the support, and starting with 311, which is a free call. But it's really important to note that. Okay, let's see if we can get this one last question in, Carmen, before we run out of time.
Sure, and I put thanks for forwarding, Chief Goldstein. I put that that website on the chat. So the last couple questions I think we can sort of combine. How have you been maintaining your personal health and your personal development related to coronavirus during this crisis?
Okay, thank you, Carmen. And so, Robert, we'll start with you. We'll go a quick round robin in our last 2 minutes, because you actually talked about this, about how you're doing some of the regular work in this new way that we're working. And so what's your answer to that question?
Well, I don't know if the question was meant to be a personal question and asking us individually as to how well we're taking care of ourselves.
I think so, yeah.
Well, I hate to even really admit this. It's been a little bit more difficult in terms of, you know, I eat a little bit more than I typically would. I don't get as much exercise as maybe I would otherwise by being in the office and running around and walking around. So I need to be a little bit more disciplined to ensure that, you know, I'm there for the people who work for me, and that I'm, you know, mentally and physically sound to do so. So I have some work to do there.
Mm-hmm. Well, and I appreciate your honesty. So one of the things we've been talking about in these webinars is just the truth and vulnerability in being leaders, right? Because we are all in charge of big things. And so I think it's helpful for people to hear what our honest answers are. And to me, that's the mark of a leader, right? So I said in a webinar last week, I was exhausted, and I'm still working out every single day, but I was honest about it, right? And so I just think I appreciate your answer.
Well, not only that, but, you know, the people that are on this panel, look at the numbers of people who work for these people.
Yeah.
Between, you know, Scott, you know, Chief Goldstein, Chief Jones, and Lily, and the people whom she represents. I mean, we're responsible for a lot of people and the well-being of a lot of people. So there's a lot of, you know, there's a lot of emotional stress on us. But I think as leaders, we've been found to be able to deal with those things well, and you know, we'll come out at the end being stronger and better for it.
Mm-hmm. I agree. Chief Jones, let's go to you.
Yeah. So what I've done is and I think Robert's spot on. I mean, you know, I find myself putting in a lot of hours daily, right? For a lot of different reasons. And so what I have to do sometimes is I really have to look at my schedule, and I force myself to kind of slow down a little bit. Some days I don't really push myself to come into the office. I really kind of just stay at home. And even if I'm just doing a little bit of work from home, it kind of like just changes the environment. And I also, on weekends and on particular evenings, if I can, I really do try to put a little bit of exercise. And even if I'm just going on a daily walk with the wife and around the neighborhood and just talking about other things other than work, it helps to ease my mind. And I think that's vitally important for us to do those things and engage a little bit and think about things that are outside of the job every day, because this can really, I tell you, to overwhelm you. And I've found that to be the case. And I make sure that my staff also understands that they've got to get away and get some downtime as well.
Thank you. All right, Scott, and then we'll finish out with Lily.
And this is, we said it from the beginning to our folks, is that this was a marathon. This was not a race. And talking that this is 2 months or week 8 is just a slight clue to that. You know, we anticipate service changes and this impact taking us throughout the rest of the calendar year, as we know what we will be dealing with pertaining to protecting our people. Marie, the fanatical approach to exercise that I have from what was before. So absolutely, the opportunity to get, while it may be in the community, walking with an appropriate social distance and taking the dog out for a walk each day. Not today, I don't think. The dog doesn't like it, but the physical relief you get from personal exercise is one by far. The other thing is you got to, I do, you have to read your body and recognize when your body says you're tired, and do exactly like Marcus said, self-regulate that and recognize, okay, I'm not going to do this today or that today. I got to tone it down a little bit and be able to continue, because we are maybe all Energizer bunnies, and this is one where the battery or the candle is being burned on both ends, and we just have to really moderate that, because we'll burn out.
Mm-hmm. Thank you. All right, Lily Chi, you're going to close us out.
Thank you very much. I think when the community is counting on us, we just have to take the time to take care of ourselves to make sure we're there for them. So in my case, because you cannot access gym or yoga studios and so forth, I just, went online and followed their online stream to try to working even 30 minutes or whatever, jumping around and kicking around, just to help myself balance that little bit of personal time. And it works like magic. Every time you do that, you feel really great about it. It is the most difficult part is to walk away from the computer, work away from the news and from whatever the next email you need to respond to. But I think blocking out some personal time, even if it's like a 9 or 10 p.m. every night. And I just, I also started the routine of making sure I just write a brief diary every night, right? And that helps you think about, oh, what did I do today? And maybe I will try something different, and then maybe start some new stuff to just kind of distract yourself purposefully to learn something new and join other online opportunities. And this is a great time also to connect with people you haven't been connected with for a while. And I think, everybody figures out their own ways of balancing. And when I find myself getting overly anxious and agitated over some issues that I cannot help with, I just walk away for a few minutes and come back. I think everybody regulates ourselves differently. The key is know yourself, and there's a place and time for everything.
Thank you. So I think some of the core messages we really heard that we're to summarize is being able to pivot, making sure we're over communicating as much as we can, making sure we're self-regulating and taking care of each other, and acknowledging the pressure that you're under and trying to figure out how to take a break from that and step back to it. Some of the themes that I've heard. And we just, here at Leadership Montgomery, want to say thank you so much for all the work that you're doing to support this community. We know it's a huge task, and so it does not go unnoticed. So we're giving you air applause, and to say thank you for taking even this hour to listen and chat with us, so the folks on the phone or on the computer can hear it, and we're going to rebroadcast this. So we thank you all, and wish you well.
Thank you.
Want to jump in?
Well, the one question that was lingering, and I think it's definitely on the minds of those out there, is antibody testing.
Oh, yeah, that was one of the questions in the chat, yes.
And the answer is through healthcare networks and healthcare providers.
Yep.
The nuance is there's a few out there. The reliability or the error rate or the accuracy of those is a little bit in question. And it is definitely a possibility that as testing gets refined, that the antibody or the immunity testing will be improved as well. Because everybody's learning every day about this. We think as it's relating to an influenza style illness, that you end up with immunity for that cycle from it after you get the flu. But it's possible as well that you do not have a large antibody immunity in your bloodstream after this. So it's a part, but it's through your healthcare network. I have not heard of antibody testing being available through public health yet, or through the county support network. But I think it'll be coming, but it's just a little bit early on that chain. It's probably 2 or so plus weeks away before that may be a possibility through the county networks.
Thank you for that. And so if any of you have any other resources that you want us to share with the Leadership Montgomery community, or even the community at large, so we have a large following, please make sure to send it to Carmen, and we'll push that information out. For those of you that are still watching and hanging with us, we're a little late, but we'll have this information up on our website. Carmen is doing a great job putting up information as we receive it through credible resources for you all. And so with that, we will say thank you. Have a safe afternoon, and we'll talk to you soon.
Thank you, Marie.
Everyone.
Thank you
Thanks,
all.
everyone.
Appreciate the support. Thank you.
All right, thanks.
Bye-bye.